Welcome back. You're still watching NTV Weekend Edition. Thank you for staying with us. And if you're just joining us, I am Sandra Twinodio with Susan Muchawa on the sign language. Well, just to remind you, every 25th of April, the world commemorates World Malaria Day that is set aside to raise sustained support for malaria control among stakeholders. Uganda still contributes about 5% to the total deaths in the world, but also Uganda recorded a reduction in malaria prevalence from 42% in 2009 to 9.2% in 2018, according to the Malaria Indicator Survey. This year's celebration comes at a time the world is battling the COVID-19 pandemic. Hence the theme, Zero Malaria starts with me, and under the slogan, Why Survive COVID-19 and Die of Malaria. So they do also ask you to sleep under treated mosquito net, and tonight we speak to Dr. Jimmy Opigo, who is the Program Manager, Malaria Control Program in the Ministry of Health. Welcome to Talk of the Nation tonight.
Thank you and good evening, viewers.
Well, we would like to start by asking you to take us through how far we have come in the fight of malaria. Are there any new interventions either to end it or to reduce it completely?
We have made tremendous progress in the fight against malaria. The prevalence, as you noted, has dropped to 9.2% averagely, but there are places like in and around Kampala, in the west, where it is as low as 1%. We have just done a review and we have positioned ourselves now to accelerate reduction and drive certain sections of this country, like Kigezi region, towards elimination.
All right. We also hear that some scientists have been working on a vaccine. Should we expect this vaccine anytime soon?
Now, the vaccine is at almost final stages. Final tests are taking place. However, even when it is certified, we have to organize financing. We have to organize a health system to deliver it. We need to integrate it in our routine immunization schedule. It is just going to be one of the additional tools to malaria control, but the vaccine will target mostly children. So it will not work alone, but it will be a very welcome tool for our fight against malaria.
Okay, we look forward to that. And I know you know for a fact that during this period, a lot of focus is on COVID-19. Have you seen any change in the number of cases, malaria cases reported at different facilities in different parts of the country?
At this time, indeed, we all have to focus very seriously on COVID and observe all the presidential directives towards its control. However, as malaria and many other diseases which are endemic, they don't go away, they remain. So we have to adjust the programming in such a manner that malaria still is controlled. For example, just imagine a child is sick in the night. There's a curfew. You cannot seek care. You'll have to wait for the next day. So what we have done quickly is to empower our community health workers, the VHTs. And the VHTs are within the communities. So even in a curfew, you can go 500 meters and seek care. Okay. The same during the day, there is difficulty of travel because taxis are not operating, borders are not operating. So in that case, what we are doing, we are emphasizing that during this time, people have to double malaria prevention because seeking care is a little bit more difficult. The next thing we have done is when COVID came, some health workers somehow developed fear of attending to patients with fever. So the government and Ministry of Health quickly made sure that all health workers access personal protective gear so that they don't fear attending to patients with fever, because malaria presents with fever like COVID.
Yes.
Okay? So this has also been put in place.
Do you think that has probably influenced the number of people that go to the hospital to get checked once they have the symptoms of malaria?
According to the latest reports, last week we got over 167,000 people coming to facilities to get malaria care. So service somehow has been disrupted, but this adjustments have still made it possible for people to seek care. The rest we know could be getting care within the communities through village health teams.
Okay, now that the topic that is dominating the media waves is COVID-19, have you seen any reports, or have you been in touch with anybody that probably has COVID-19 and has malaria as well?
Now, quickly when COVID came, we set up a study. It's actually an international study, partly because one of the medicines used to manage COVID, is hydroxychloroquine, which is also an anti-malaria. Then again, COVID is coming for the first time in a place endemic for malaria. So we are quickly actually studying what is happening and whether some people are presenting with both. But the first group we got for COVID mostly traveled from abroad, from places where there's low malaria. However, we are studying this very closely. The details will come out at the right time.
Any time from now. All right. Now, looking at this year's slogan, how can we ensure that people do not ignore or do not relax in the fight against malaria?
Now, we are doing a very big campaign, and we thank you for this opportunity as well. It is part of the campaign to make people to realize that it is the wrong time to get malaria. First, we burden the health system, because almost 30% of people coming to facilities come because of malaria. So if we could reduce this, we reduce the load on the health workforce so that they focus on COVID, attending to COVID control, educating people, running the tests, running the quarantine centers is already a very big burden to the health system. Again, if we have so many fevers which have to be investigated, we shall have so many people to test for COVID. The tests are very, very expensive. So our focus is to get the people to understand that be kind to the health system right now, double your effort of preventing malaria, because it is possible to actually prevent malaria if people focus on making sure mosquitoes don't bite them. And that is the focus of this World Malaria Day. That Zero Malaria starts with me or with you, that we all take the actions. But for Uganda, we added that catchword, why survive COVID? No, we have taken extreme measures to survive COVID. And then you get careless on another thing and it kills you. Why survive COVID? And I understand in Nigeria, for them, their slogan is, your fever may be malaria. You may be focusing on one thing, but something else takes you off.
So ideally, for the people watching us tonight, once again, the slogan for this year's in Uganda, Malaria Day, it is why survive COVID-19 and die of malaria. So do please do not neglect the fact that you can actually get malaria while you're concentrating on fighting COVID-19. Now let us hear your thoughts on how the COVID-19 is shaping the efforts of fighting malaria.
The COVID-19 is somehow, I don't want to say a blessing in disguise, but has brought a lot of health consciousness. People have got to realize that it is their responsibility to prevent diseases. Actually, and you see the president in a joking way says, getting diseases is indiscipline. Okay, so people stay home, people stay indoors, so they have now more opportunity, actually, to tuck the kids in when they are going to bed. In normal times, as adults, we may return home late when kids have gone in, when we are dependent on the house help to put them properly. Now we have opportunity to close the windows at 5 p.m. because we are at home ourselves, to spray the house every evening and tuck the kids properly. So let's take this opportunity now that we have time to reflect on the correct practices, the correct behaviors to keep healthy.
Okay. We also know there are global targets to end malaria by 2030. As a country, where do we lie towards meeting this target?
Now, we had set very ambitious targets by this year to be at 7%.
Okay.
We at 9.2%. Just 2 percentage points side the position. We have set ourselves for 2030 also to get done. Right now, we have just completed writing as a plan for 2025. We want to be at 5%, so that the remaining 5 years we are able to do. But as the World Health Organization released today, that the disruption of livelihood, of health system by COVID threatens a lot of reversals. Because malaria is a livelihood issue, a poverty issue. So if there's big economic and economic impact of COVID to individuals, there is a big likelihood of reversal of the gains. So we are doing everything so that we keep on the trajectory to have this issue dealt with.
All right. So the ministry is doing the best they can to ensure that we meet the target 2030 of ending malaria. So we do thank you, and I hope for the people watching us also we can do our part. Why survive COVID-19 and die of malaria? So please ensure that you sleep in a mosquito net, and also if you have the symptoms, visit medical facilities, and don't forget that if you're pregnant, also take your anti-malarial drugs so that you protect yourself from getting malaria. Thank you all for joining us, and thank you too for joining us tonight on Talk of the Nation.
Thank you.